Well, Trump says the U.S. has enough tests to begin reopening safely, but governors who've had to make the decisions want to test much more of the population to feel safe. Let's unpack these dynamics further. We're joined now by Professor John Stremlau, who is the visiting professor of international relations at Wits University. Prof, good evening and thank you for your time. There is deaths on both sides, he says. Whether there is a lockdown, there'll be deaths. And there is if they open up the economy, there will be death. This, of course, epitomizes what Trump has been thinking about this COVID-19 pandemic.
Well, one thing you have to bear in mind is that nothing this man says can be taken at face value, because he has a record of mendacity which is breathtaking. He's handled this crisis in the most shambolic, incompetent way. He was warned about it coming back in February and did nothing in February and March. We have very few capacities in the United States, which is the richest country in the world, to handle a reopening in a systematic way. I'm thinking a lot about this because I'm living here under a president who has shown both an honesty and an openness from the very beginning and a willingness to defer to the scientists. And
that's Professor John Stremlau. They seem to have lost him on the line. Prof, I think he's back with us. Prof, yeah, you can go ahead.
Can you hear me okay?
Yes, I can hear you okay now.
Okay, fine. I was just saying that President Cyril Ramaphosa, our president, has been a model of being straightforward and being disciplined and being early out of the box, but also trusting with the science. Donald Trump has asked us to believe whatever he says by whim, whether it's with regard to the disappearance by miraculous means of this disease, which he said back in early April, whether it's the fact that you should maybe think about Clorox or something, some sunbeam or whatever kind of science. He says he's no scientist, no doctor, but why does he insist on not supporting the findings of the health professionals? And he's got a terrible record in this regard. He is, in a sense, a demagogue who's been caught out by the pandemic. But the tragedy is, and you mentioned how many cases there are over 90,000 deaths. And those deaths, by the way, have fallen disproportionately on the African-American community and those frontline workers who are part of the lower class. And that's exactly what has motivated Cyril Ramaphosa here to try to have a coherent national policy that would try to bring us all together, not divide us. And Donald Trump is running for re-election, and he's dividing the American people in a way that is causing great offense internationally, and you know what's been happening at the World Health Organization. I won't belabor this, but you can't expect me to pretend that he is anything but a total disaster when it comes to managing this crisis.
With respect to the governors, then, the governors have been given that responsibility of reopening, and many of them have been saying this is passing the buck without passing the actual bucks. In fact, Governor Cuomo at some point was quite fed up with the president, to be quite honest, and he says he must stop watching this on TV and tweeting and actually do something instead of doing nothing. But that decision by President Donald Trump to let the governors be the ones who decide on the reopening.
Well, what you are seeing happen, and I don't want to attribute motives to this man. I don't understand how he thinks, but I do know what he says and what he does. And he has taken a strategy for re-election that seems to me to, on the one hand, blame China for causing this disease, and then secondly, offloading responsibility for dealing with it to the governors, even though he did not have or provide a national framework and a strategy. He has a strategy for re-election, and damn the torpedoes, he's going full speed ahead, but he does not have a strategy, as Cyril Ramaphosa does, for dealing with the disease, lowering the curve, trying to do testing and getting it and tracing done early. None of that was in place, and what's even more reprehensible was that when he came to power, he disbanded the pandemic preparedness systems that President Obama had put in place after the Ebola and SARS crises, particularly the Ebola one. And President Obama's response to Ebola, which was a much more lethal but not as contagious disease as the COVID-19, was to put in place a system that was very similar to what you would expect President Ramaphosa to do, based on science and being clear and honest about what we know and what we don't know, and getting people to work cooperatively together internationally. And Donald Trump has done all of the
All right, we seem to have some technical difficulty there with Professor John Stremlau on that line. Well, we've got citizens who are living in the U.S., South African citizens living in Texas in the U.S. that sent us some commentary as well. Here's a video from Courtney, who is in Houston, on the reopening of the economy.
Just a local update on the coronavirus. As of Monday, life has pretty much tried to resume as normal. Salons have opened, people are able to go get haircuts. I know that the department stores have opened up again. They have a strict occupancy of 20 to 25%. So they have a manager at the front actually counting each number of customers coming and leaving. They do advise that you be extra courteous, wear a mask. Between the customer and the cashier, there's a glass between the two to prevent any spread across the counter. They're sanitizing all of the carts, trolleys, and yeah, pretty much people have tried to resume life as normal. People have gone back to work, highways are busy again. So I do know that locally there's been a spike in the number of new cases, obviously because people are now venturing out into public. But yeah, they are trying to implement some safety measures, continuing to wear masks. There are no laws, against not wearing them, but they are trying to implement that you be courteous.
That's Courtney there, South African citizen living in Texas. We seem to have the line back with Professor John Stremlau. Prof, I hope the line is going to hold up. But the other question that I wanted to ask you is why are we seeing this contradiction happening now between the health specialist and President Donald Trump? And is Dr. Anthony Fauci, who's been, by the way, serving the White House now 6 presidents, likely going to be fired?
Well, that's what the gossip is nowadays. Trump has felt he couldn't fire him, but he pays no attention to the health scientists on this. He trusts his instincts, and above all, he wants to get reelected, so he is pressing ahead.
And as far as the opening up of the economy, it has been, of course, a big part of Donald Trump to see the markets active again. Others have even said he's more concerned about the markets and less concerned really about the lives that are being lost. The fact that the governors are all opening at different intervals and using their own discretion, how is that going to impact on the economy itself?
Well, everything is linked. So, this disease spreads around the country, and so Texas is doing not such a very good job of ensuring that they know what the status is of the disease, whereas New York and California have done a pretty good job. Once again, that this has fallen most heavily on the African American community and on the Hispanic community, and that